Developing food allergies as an adult is super tough, and actually adult food allergies are way more common than we think. This study that was done in 2019 used a survey to see the assessment of food allergies in the US population. One of the interesting findings was they found that food allergies in adults was actually 3 times more prevalent than previously believed. So the study was done using phone surveys and then assessing whether or not the person's food allergy has a convincing history. Now, taking a step back, the gold standard for a food allergy is what's called a food challenge. If I give a person eggs and then they present with hives, nausea, vomiting, shortness of breath, that's pretty indicative that they have a food allergy to eggs. So if I ask somebody on the phone, do you have an allergy? And they say I have an allergy to eggs. When last time I had them, I had nausea, vomiting, hives. That's a pretty high pretest probability that they're allergic to eggs. If they say I'm allergic to milk and I get some bloating and diarrhea, that's not as high as a pretest probability. So doing a survey to assess the prevalence of food allergies in this way is actually pretty interesting. They found that the self-reported food allergy was around 19%, but they found that the convincing food allergy was around about 11%. So 11% of US adults appear to have a convincing history of a food allergy. So let's see these adults that are having food allergies, because there's some interesting findings here. The first is their age. If they were greater than 60 years old, it was protective against having a food allergy. They had a decreased odds of having a food allergy. But the younger they got, it appears around 30 to 39, there was a significantly higher prevalence of having a food allergy. Meaning that it's not just that adults are having food allergies, but it's really adults that are less than 40 years old that are really starting to see food allergies in them, essentially around my age. Significantly higher in females than males, but still going up for both. And this part's really interesting. The other allergic conditions that they have, the increased odds that they have asthma, eczema, insect sting allergy, or something like that. The reason why that's so interesting is because a lot of allergists, they don't really think of allergy as you're allergic to peaches, or you're allergic to eggs, or you're allergic to milk. They think of it more as that you're in a state of atopy. You are in a state of being allergic. You have a propensity to become allergic to new things, and you're developing allergies to kind of these metaproteins that are across multiple species that are presenting with multiple symptoms, just such as having like a grass allergy and starting to become allergic to peanuts, or having a birch tree allergy and starting to become allergic to peaches. Think about it like this. Half the population is essentially not allergic to anything, for the most part, and the other half are allergic, and they're just manifesting that allergy in different ways. Some as asthma, some as eczema, some as allergic rhinitis, and some as food allergies, and some as many as several things. So we don't know 100% why this is starting to increase in adults, but it's most likely a combination of all the things that we assess that seem to be increasing food allergies in general, which is a combination of climate change, the different way we process our foods, changes in the microbiome due to household chemicals that we might be using, and increased use of antibiotics, increased pollen, developing increase in oral allergy syndrome, combined with a genetic predisposition for having the allergy in the first place. So you combine all that, then it's just a matter of time before a person becomes allergic to something, and then once they become allergic to something, that allergy can start to spread amongst many other things as well. Okay, hope that answered your question. Hope that helps.